Hi, in this video I'm going to be demonstrating how to apply ultrasound treatment to a patient. Of course, I don't have an actual ultrasound machine with me and I'm not in an actual athletic training facility, but I'm just going to be doing a general application overview with makeshift items. So ultrasound is sound wave vibrations of high frequency that produce thermal or non-thermal physiological effects. This patient has a supraspinatus muscle strain. The supraspinatus is one of four rotator cuff muscles of the shoulder. It aids in shoulder abduction for the first 15 degrees, and then it also produces stability of the shoulder during movements. So it lies at the superior aspect of the scapular spine, and then some tests that I would do for this injury assessment would be an empty can test or maybe a drop arm test. So to start off, I would just position my patient. If I was in an actual athletic training facility, I might have them lying prone or maybe seated in a reclined position on a treatment table. Of course, I don't have those things. This is how I'm going to be positioning my patient for now. And then I would prep my equipment and my patient. So I would take an alcohol prep pad and I would clean the patient. And I would also take my ultrasound head and clean that as well. And then while I was doing this, I might talk to my patient, and if he has never done ultrasound before, I would make sure that he was comfortable. So I would explain what ultrasound is, how it works, what he could expect to feel. And then if he was still apprehensive and worried about the treatment, I could demonstrate on myself, just make sure that he was comfortable. So once I did all of that, I would turn my ultrasound machine on, and then I would set my parameters for this specific treatment. So I'm going to have my heat warming on. I'm setting the frequency to 1 megahertz just because this is a deep muscle. It lies beneath the trapezius muscle, so I would want those deep tissues. So 1 megahertz for that, and then my duty cycle would be at 50% because it's a subacute injury. The treatment time would be 10 minutes, and then for the intensity, I would probably go to about 1.5 watts per centimeter squared. And then I also am selecting a 5 centimeter sound head, and then while I was putting my treatment on the patient, my treatment size would be 2 times the size head. So then I would apply my ultrasound gel to the sound head, and then also to the area where I would be treating the patient. I would press start on my ultrasound machine and then turn up the intensity when I began, and I would just make sure that he was comfortable. If the sensation was too much, then I would lower it, and if it wasn't enough, then I would increase it. So I would just do small circles at 2 times the head size. I'm only going to be moving at about 0.5 inches per second. And I would just do this slowly in that area, and I would keep talking to my patient while I was doing it, making sure that he was still comfortable. And then after the 10 minutes is up, I would turn my machine off, and I would get my towels and I would clean my equipment. And I would also clean my patient. And then now that the treatment is over, we have about a 5-minute window to start any stretches, exercises, or massage therapy for this specific injury. So after cleanup and after we did our additional treatments, I would set the next treatment for this patient, and I would record everything I have on the machine to make sure that next time I do this treatment, I could do the exact same thing, or if someone came up behind me, they could repeat the exact same treatment if I wasn't there.